Obesity and joint health are intimately connected, and this relationship becomes especially dangerous as the body ages. The combination of excess weight and aging joints creates a perfect storm for osteoarthritis, one of the most common and debilitating conditions in older adults. While many expect some joint discomfort in later years, what is often overlooked is how obesity accelerates, intensifies, and complicates that decline, turning manageable stiffness into chronic pain, limited mobility, and a loss of independence. Joints are mechanical structures. They bear weight, absorb shock, and allow for fluid movement. When a person is overweight, each step delivers greater force through the knees, hips, and lower back. Research suggests that for every extra pound of body weight, the knee experiences about 4 pounds of additional pressure during walking. This means that a person carrying 25 extra pounds is actually subjecting their knees to an additional 100 pounds of force with each step. Over time, this constant overload wears down the protective cartilage that cushions the joints, eventually leading to osteoarthritis. Osteoarthritis is not just wear and tear, it's a degenerative joint disease fueled by inflammation and mechanical damage. As cartilage thins and erodes, bones begin to grind against each other, causing swelling, stiffness, and intense pain. For older adults already coping with age-related cartilage thinning, obesity adds a heavy and relentless load, causing this process to unfold faster and more severely. The knees and hips, which are already among the most used and weight-bearing joints in the body, are the first to suffer. But the damage isn't only mechanical. Excess body fat, especially visceral fat, acts as an endocrine organ, secreting inflammatory cytokines and adipokines like leptin and interleukin-6. These compounds enter circulation and promote low-grade systemic inflammation, which contributes to joint degeneration even in areas not directly bearing weight. So even if someone is sedentary or not placing much stress on their joints from movement, the inflammatory environment caused by obesity continues to erode joint health from within. It's a double assault: weight-related stress from the outside, and inflammation from the inside. This toxic combination dramatically increases the risk of joint replacement surgeries later in life, particularly knee and hip replacements. Yet obese seniors are often at higher surgical risk and slower to recover from such procedures. Excess fat complicates anesthesia, increases infection risk, and makes rehabilitation more challenging. Some orthopedic surgeons may even delay or deny surgery until weight loss is achieved, leaving the patient stuck in a painful limbo where moving is necessary for weight loss, but too painful to attempt. Unfortunately, this leads to a dangerous downward spiral. As joint pain increases, movement decreases. As activity levels drop, muscle mass declines, and weight often increases further. This creates a vicious cycle of worsening arthritis, physical weakness, and growing disability. Many older adults with obesity end up confined to chairs or relying heavily on canes and walkers, not because they're unwilling to move, but because their bodies can no longer support them without pain. What begins as mild joint discomfort can end in total mobility loss and dependence on others for basic tasks. There's also a psychological cost to this trajectory. Chronic joint pain and reduced mobility are major contributors to depression and anxiety in seniors. The frustration of not being able to walk, climb stairs, or play with grandchildren chips away at emotional well-being. Social isolation often follows, which worsens both mental health and physical decline. The pain is not just in the joints, it's in the entire life that begins to shrink because of it. Yet this bleak outcome is not inevitable. There is strong evidence that even modest weight loss, just 5% to 10% of body weight, can significantly reduce joint pain and slow the progression of osteoarthritis. Losing weight decreases the mechanical load on joints, and it also reduces inflammatory signals in the body. A dual benefit, attacking both the mechanical and inflammatory drivers of joint damage. In some cases, the pain relief from weight loss is so significant that medications or surgical interventions can be delayed or avoided altogether. Exercise, though painful at first, is one of the most effective tools for managing osteoarthritis. Low-impact activities like swimming, cycling, and Tai Chi can strengthen the muscles that support joints, improve balance, and reduce stiffness without putting undue stress on cartilage. Physical therapy, targeted strength training, and mobility work are all crucial in helping older adults regain function. In many cases, the goal is not perfection or complete reversal, it's stabilization and prevention of further decline. Nutrition also plays a critical role. Diets rich in anti-inflammatory foods, such as fatty fish, leafy greens, berries, nuts, and whole grains, can help mitigate joint inflammation. Reducing added sugars, trans fats, and ultra-processed foods helps calm the body's immune response and reduces pain levels over time. Some supplements like omega-3 fatty acids or curcumin have shown modest benefit for some individuals, but they must be part of a broader lifestyle shift to be effective. Importantly, interventions must begin early. Too often, joint pain is dismissed as normal aging, and weight gain in older adults is seen as unchangeable. But early attention to weight, movement, and inflammation can preserve joint health well into later decades. Prevention is always less painful and less costly than treatment. Doctors, caregivers, and families should be especially vigilant about joint complaints in overweight seniors, as they may be the first sign of a deteriorating condition that can still be reversed or slowed. Ultimately, obesity accelerates joint aging, turning natural wear and tear into crippling arthritis and robbing older adults of movement, freedom, and dignity. But the pathway to disability is not fixed. With timely and sustained effort, the stress on joints can be reduced, inflammation can be controlled, and mobility can be preserved. It requires commitment, but the reward is enormous. A life not ruled by pain, but by strength, confidence, and the ability to keep moving forward. Ignoring the joint impact of obesity in older adults is not just a medical oversight, it is a silent tragedy unfolding every day. But with awareness and action, it can be prevented.